Hello everyone. Uh, Welcome to my occupational therapy video blog. Today I want to give you a brief overview of what occupational therapy is with a definition and kind of talk about what it looks like in the various settings that you might find it. So for starters, the definition that my good friend Becca and I kind of came up with, compiling their ideas together, is as follows. Occupational therapy means supporting health and participation in life through engagement in occupation as independently and safely as possible. Now, when you give a definition like that, usually the next comment from whoever you're talking to is, oh, so you help people with their jobs, or oh, so you help people find work. That's not the only definition of occupation. In our field, occupations are the activities that make up your daily routine that make your life meaningful. Um, One quote that we found in the uh, framework, occupational therapy framework, uh, their definition is occupations are central to a client's identity and sense of competence and have particular meaning and value to the client. They influence how clients spend time making decisions. So some examples of occupations to kind of give you a clearer idea of that would be activities of daily living, which include just how you take care of yourself every day. Um, doing your morning routine, getting dressed, eating, uh, all those, moving around, all those basic ideas. And then instrumental activities of daily living include things like taking care of pets, or going to the grocery store, or being able to use public transportation or drive yourself places. Another occupation is actually rest and sleep. So that includes how you get ready for bed, how you prepare to sleep, and the quality of your sleep, how long, how often, etc. We also have education and work, which are pretty self-explanatory in that they're their own occupations. And then play for children and leisure for adults. So they can kind of overlap in a way, but usually play is um, the definition given to children and leisure is given to adults. So for children, play is their main occupation. That's how they learn. That's what they do all day. And leisure for adults is usually time set specifically aside, like I'm going to go sit down and read a book, or I'm going to go hiking with my friends, or something like that. And then social participation is also a major occupation for anyone. Just, how do you uh, work with other people? How do you get along with your friends? How do you make friends? Um, are you a hermit? Are you a social butterfly? And all of those pieces together um, bring together who you are. The way occupational therapists help people when they have difficulties in an occupation is by examining the environment and a person's abilities and the activity itself. So, for example, if the occupation you want to look at is education, the environment you want to look at is the school setting, the classroom setting, um, the playground, what is in the environment around them, and the person's abilities. So what are they good at? What are they not so good at? What are some struggles? What are some strengths? And then the activity itself. So education, or even more specifically, could be writing or science, whatever it might be. You take all of those together and then as an occupational therapist, we find ways to adapt, compensate, improve, or change things to enable participation. So do we need to bring in an object or a person to assist the client in completing something? Do we need to change part of the activity to make it where they can be successful? Or do we need to just make something better? anything like that. So now I want to talk about the major settings that you find occupational therapy in and kind of what it looks like in those settings. So the first one that I want to talk about is the skilled nursing facility. They are pretty commonly known as nursing homes. It is usually older people, older adults, and it consists of daily care. The patients live at the facility. They may be there for days, they may be there for weeks. Sometimes it could be more long-term care. And we refer to that as subacute. And an occupational therapist in a skilled nursing facility would work on strengthening, conditioning, activities of daily living, functional mobility, which means how you get around your environment, surgical precautions. So, for example, you might see a lot of hip replacement surgeries. So, the occupational therapist would go and make sure that the person understands what they can and cannot do while that hip is healing. And also edema care, which you can kind of look up what edema is if you're not sure, but it's basically the swelling, the extra fluid, the lymph fluid ends up where it's not supposed to be, and so occupational therapists can help with that as well. Aside from hip replacements, you usually see diagnoses such as just general weakness in the older population, or post-stroke, or after some other kind of surgery. Individuals usually go to the skilled nursing facility after they've been at the hospital and before they discharge home, so to kind of continue the healing process and determine if they're going to be able to go home and when they'll be able to go home. So the next setting I want to talk about is a hospital or an inpatient. Again, this is daily care, and the patients live at the facility. They're usually only there for a few days, and we refer to this as acute. So in occupational therapy, you would look at wound care, if they're in the hospital for an injury, or even for after a surgery. Activities of daily living, surgical precautions, preparation to go to the skilled nursing facility or home, and again, edema care. You might see accidents like a car accident or fire or a fall. You might see people that are from the military who have been injured. You might see long-term diseases, or and flare-ups of those diseases, and post-surgery, various kinds of surgery. The next setting is outpatient, and I'm going to also include hand therapy in this because that's a pretty well-known area of occupational therapy, but it is kind of a specialty within outpatient. So in outpatient, a patient visits the clinic from home, and they come, one or more times a week, depending on their plan of care, what they need. And it's usually used for follow-up care for surgeries or stays at a hospital or skilled nursing facility to kind of see how they're doing and make sure they're keeping up with their precautions, medications, make sure everything is progressing the way it's supposed to. We might see new injuries or conditions that don't require hospitalizations necessarily, or that do. Might be sports injuries, etc. More edema care, strengthening and conditioning, just preparing them to be discharged from therapy. And a person can go to outpatient for weeks, months, or years, completely depending on what their condition is. And occupational therapy can also be seen in schools. This is usually preschool through 12th grade. And sometimes the kids are pulled out of class to go to therapy. Sometimes the therapist goes into the classroom to work with an individual child. Or the occupational therapist might look at the classroom in general and work on how to make it a better learning environment for everyone. and we usually call that an inclusive classroom. In a school, you will see various learning disabilities, autism, cerebral palsy, behavior disorders, anxiety disorders, sensory processing issues, and ADHD. Some of the things that an occupational therapist would work on in a school include handwriting, um, sensory integration, socialization, play, uh, gross and fine motor activities. Gross motor includes actions that you do with a larger part of your body. You know, it can be sports or just walking, how you navigate your environment. And fine motor includes things that you do just with your hands, so handwriting or moving an object around in your hands, just, you know, little things like that. We also work on modified classrooms and modified tools to assist the child that needs our help, and staff education. Also in the schools, you might hear about an IEP, or an individualized education plan, and that is made by the various therapists working with the child and the teacher and the parents in creating a strategy for the child to be as successful as possible in school. And there are meetings yearly to address it and update goals, things like that. So aside from the schools, another place where an occupational therapist might treat children would be in pediatric outpatient. That is usually children 3 to 18 years of age, and the kids come to the clinic or center, you know, usually brought by a parent or a guardian. And in pediatric outpatient, you can work on school-related tasks, again, gross motor, fine motor, communication, socialization, play, strengthening, balance, activities of daily living, and attention. And all of these can transfer back to how they are in school and at home. And then kind of tagged onto the beginning of pediatric outpatient is early intervention. Early intervention works with birth to 3 years old, and you know, you may be wondering, what kinds of things can an occupational therapist work on with a little baby? Well, it usually involves things like motor milestones. You know, are they crawling when they're supposed to? Are they walking when they're supposed to? You know, all these crawling, rolling, all these different steps. And then when they get to be 2 or 3, you start working on preschool tasks and balance, socialization, play, basic childhood activities of daily living, and other things like that. And with early intervention, you can see, I've seen a couple different ways that it's done. Sometimes the therapist might go to the family's home to work with the child, or the child is brought to a clinic or center where the therapist then treats them. And either way can be effective. I know a lot of people argue that going to the home is the best because that's what we call the natural environment. So, you know, you're getting what the child actually deals with on a daily basis. And finally, the last one I want to talk about is home health. And that can be through the entire lifespan. So this can include the home visits with early intervention. But it's usually after discharge from a facility, or if the person can't make it to a clinic, or for other specific services like early intervention. And you know, you work on what you would work on in a lot of these other settings. It would just be in their natural environment. And of course, in each of these settings, there are specialties, and you know, there are so many, and I want to talk about the specialty of hippotherapy for pediatric outpatient coming up probably in my next video, so look forward to that. And thank you for watching my video, and please don't hesitate to leave a comment or ask me personally through a message or face-to-face or whatever if you have any questions, or if you think I missed anything, or if you have ideas for future videos. And I think that's it. Have a good day. Bye.